splitting hairs over losing your hair, you're not alone. Hair loss, known as alopecia, is a common disorder affecting more than 80 million Americans. So how do you know if you're shedding more than normal? On average, most people lose about 100 strands of hair a day, and with new strands growing to take place of the ones lost, most won't notice a difference. But if fewer or no strands grow back and you start noticing a receding hairline or thinning areas, you might have alopecia. Dermatologist talks about ways to stop hair loss, what may cause it, and whether it can be reversed. Ways to stop hair loss. Losing your hair not only affects your appearance, but it can also cause emotional stress and affect your confidence. There are a few things you can do to help stop hair loss, though. Eat extra protein. You may not be getting enough protein each day, and that can affect your hair growth. Especially if you're vegan or vegetarian, you may need to increase the amount of protein you consume. You need 40 to 60 grams a day, says doctors. You can drink your protein. You don't have to eat it in a food substance. Other ways to hit your daily protein requirement include eating beans and legumes, eggs or Greek yogurt. Take vitamins. Your doctor can perform various tests to see if you have a vitamin deficiency. Certain vitamins and minerals like vitamins A, B, C, D, E, zinc and iron can affect your hair growth. Doctor has found success with prescribing Biotin Forte with zinc, a supplement that helps maintain healthy hair, skin and muscle tissue. There are new ones that include saw palmetto, calcium and selenium, says doctor. All these are good. Just look for ones that come from a reputable company. Follow the Mediterranean diet. Eating fruits, vegetables and protein, the main ingredients in the Mediterranean diet, can be helpful, especially compared to other trendy diets. When you go on these restrictive diets, you may lose weight, but it's probably something you can't maintain, says doctor, and they're usually lacking in something that your hair follicles need. Use over-the-counter hair loss medication. You may have heard of minoxidil, the over-the-counter medication that helps in preventing hair loss. Available as a solution or foam that's applied to your scalp, the medication has been approved by the U.S. Food and Drug Administration, FDA, at a 5% strength. We've been considering using low-dose oral minoxidil as a treatment, says doctor. There are a handful of studies that show how helpful and safe it is. Try low-level laser light therapy. The FDA has approved this newer treatment to help with hair growth, but low-level laser light therapy devices, which include wands and helmets, can be time-consuming and expensive, with options costing $200 to $1,000. It can reduce skin inflammation and initiate hair growth, says doctor. It's a no-brainer. You don't have any drug interactions. You don't have any intolerance. The worst thing you can get is a little bit of scalp sunburn, which can be dealt with just by using a lotion or even just reducing the time exposure. Maintain good hair and scalp care. Avoid harsh hair treatments like heating tools, hair dye and bleaching. Hairstyles like tight ponytails or braids can affect your hair as well. Keep your scalp healthy by washing your hair and scalp regularly. Any inflammation on the scalp will affect the hair growth cycle, says doctor. Why your hair is falling out. You might start seeing more hair loss than normal thanks to the following. Genetics. Stress. Hormonal changes like pregnancy or menopause. Certain hairstyles. Damaging hair care like perms or bleaching. Medications like chemotherapy. Medical conditions like fungal infections or thyroid disease. Working with a dermatologist, you can begin identifying what might be causing your hair loss. Your doctor will ask about your health, your medications and your family history. I tell the patients to keep track of events that are unusual for them, for instance, a heavy menstrual period, says doctor. So when we go back to look for triggers, we'll have some hint at what it could be. Your doctor will also look at other areas on your body like your eyebrows, lashes, underarms, pubic area, legs and arms to assess if there's hair loss. Many times, hair loss is an indicator that something more serious is going on. Hair loss, particularly shedding, is just a sign that something has happened to the body, says doctor. The hair follicle is one of the 3 fastest turning over cell lines in your body. Anything that affects your body and throws it out of balance will affect those systems. So shedding hair is an indicator that something's wrong. Can hair loss be reversed? Yes and no. It depends on what type of hair loss you're experiencing. Some types, like cicatricial alopecia, are permanent, while others that may be caused by stress or a medical condition are temporary. Once the cause has been identified and eliminated, your hair should start growing back. Generally speaking, if the trigger goes away or whatever caused the injury to the hair follicle, then the hair will recover over a period of 4 to 6 months to a year, says Dr. The best vitamins and supplements for hair growth: iron, biotin and omega-3 fatty acids can help your strands. You want hair so healthy that it shines. But can anything other than good genes turn you into a walking shampoo ad? Yes, says dermatologist Shilpi Tarpal, MD, with the help of some vitamins for hair growth like vitamin A and biotin and omega-3 fatty acids. From coloring and heat damage to aging and health problems, there's a whole host of reasons you may want to boost your hair growth. Doctor explains which vitamins to target and what kind of results you can expect. What to expect? First, let's start with why your hair might be damaged. Coloring, blow-drying and overwashing can all harm your hair, but there are also other landmines to watch out for. Inadequate nutrition. Hair, like anything that grows, needs the right nutrients and conditions to thrive, and it starts with what you eat, as noted above. Health problems. Certain medical conditions, like thyroid issues and anemia, can negatively affect hair health and growth. Genetics. Between 60% and 70% of the population carries the gene for male and female pattern hair loss. Age. At any given time, we have hairs growing, resting and shedding, explains Doctor, but as we enter our 30s, the percentage of hairs actively growing goes down. Major life events. All hair, healthy or not, has a relatively short life cycle. It's normal to shed anywhere between 100 and 200 strands a day, Doctor notes. But some life events cause periods of increased shedding, including major surgery and having a baby. In fact, up to half of your hair can shift from a growing to a shedding phase postpartum. Doctor says that the success of using a supplement or product depends more on the duration of hair loss than anything else. People who've been losing hair for only 2 or 3 years are more likely to see noticeable results than those losing it for 10 or 20 years. You may be able to restore your hair to what it was like 5 years ago, but not much beyond that. Those are the hair follicles that can be woken up with nutritional supplementation and medical treatments, she says. Hair that has become too thin and fine can no longer penetrate and exit the surface of the scalp. You have to be reasonable with your expectations. Vitamins and supplements to help with hair growth. A well-balanced diet is the first key to top-notch tresses, but you may still need extra help to kickstart your hair restoration. Your primary care doctor or dermatologist can help you safely determine which hair growth shampoos and supplements would be the most appropriate, Doctor says. Here are 6 to consider for a full head of luxurious locks. Here are 6 to consider for a full head of luxurious locks. 1. Multivitamins. A multivitamin can help bridge your nutrition gap. Doctor recommends one with B vitamins, zinc and at least 2000 international units of vitamin D. Both B vitamins and zinc play a role in hair follicle health, with B vitamins helping in the creation of red blood cells, and vitamin D may help make new ones. You can find B vitamins in foods like seafood, whole grain and dark leafy greens. As for zinc, the mineral is in foods like beef, lentils, oysters and spinach. And if you eat fatty fish, mushrooms and fortified juices, milk and cereals, you'll get a natural dose of vitamin D. 2. Vitamin A. What's the fastest growing tissue in your body? You guessed it, your hair. And vitamin A is essential for your cells to grow, which, in turn, helps your hair grow. Your skin glands also benefit from vitamin A, using it to produce sebum. The sebum oil keeps your scalp moisturized and keeps hair healthy, but don't overdo it with vitamin A, as too much can cause hair loss. The recommended dietary allowance, RDA, of vitamin A is 700 micrograms for women and 900 micrograms for men. You can also find vitamin A naturally in foods like milk, eggs, yogurt, sweet potatoes, carrots, spinach, pumpkin and kale. 3. Vitamin C. You may already know that vitamin C is a powerhouse when it comes to your skin. But when it comes to your hair, it helps fight free radicals, which can age your hair and block any growth. And vitamin C is vital in creating collagen. The protein is used to make keratin, the protein that hair is mostly made of. And if you eat strawberries, peppers or citrus fruits, you'll get a natural dose of vitamin C. 4. Iron. Iron is used by red blood cells to carry oxygen, but iron is also important for hair growth and health. Lack of iron also leads to anemia, which can cause hair loss. If you eat red meat fewer than 2 or 3 times a week, consider an iron supplement, advises doctor. Foods that contain iron include red meat, dark leafy greens and legumes like lentils, tofu and beans. 5. Omega-3 fatty acids. Omega-3 naturally occurs in foods such as shellfish and flaxseed, but you can also find it in supplements like fish oil. It's critical to cell health and is thought to make your scalp and hair healthier. 6. Biotin. Taking biotin for hair growth may be just what the stylist ordered, and since it's a water-soluble B vitamin, any excess will leave your body through urine. Doctor recommends taking 3 to 5 milligrams daily. You can also get biotin from your diet by eating foods like egg yolks, whole grains, fish, seeds, nuts, sweet potatoes, broccoli, cauliflower and meat. Other hair growth remedies. Doctor also suggests considering the following to help with your hair growth goals. Zinc pyrithione. Zinc pyrithione is the active ingredient in some over-the-counter anti-dandruff shampoos. And these shampoos have a hidden perk. They've been shown to grow hair, too, says doctor. This is because we all have some yeast that lives on the scalp. If that yeast grows too much, microscopic inflammation causes our hair to shed. You can use these hair growth shampoos to improve scalp and hair health, even if you don't have dandruff or flaking. Minoxidil. Minoxidil is a foam or solution you apply directly to your scalp. While it can be an effective way to regrow hair on your head, it may work a little too well. It has a field effect. If you put it in one area, you might notice hair growth on your face, doctor cautions. It also should not be used by women who are pregnant or breastfeeding.